Welcome to Medical Choices, a television show that is here to inform you and empower you when you need to make medical decisions. These decisions range from ones you must make regarding your own health care, to health insurance you buy, to the hospital you donate to, or even who you vote for. Our guest host, Dr. Clemente, talks with Dr. Mehmet Oz of New York Presbyterian Hospital, Columbia, about the amazing use of robots in performing heart surgery.
Robotic surgery, mechanical hearts, and interestingly, complementary and alternative medicine are really the cutting edge of the healing practitioner's armamentarium. It's the tool that we use to make people get better. Now, let's start at the highest tech, robotic surgery. Because really, alternative therapies are the globalization of medicine. The same way we have global media, global financial markets, in medicine, the remarkable
point, biventricular pacing, or this concept of what's called cardiac resynchronization, has been a dramatic improvement in reducing symptoms and improving patients' quality of life. It requires some technical expertise in terms of implanting the device by putting in a conventional lead in the lower chamber of the heart, threading another lead through a coronary sinus, which is a vein around.
It's therapeutic. We don't know why, but in the worst of times, we need humor. There was humor in concentration camps among American slaves. There's humor among people who were sick.
Laughing is not voluntary. It's something that you do because you can't help yourself. People who are ill in particular need to know that. And they need to go out, maybe if they can, or watch funny movies or funny television shows and things that will make them laugh, even read funny books, anything to get those endorphins going and to take you, I mean, it's a sad state of affairs when you're sick, and sometimes there's nothing to do but laugh.
The toilet with the Hammaker, Schlemmer, the LL Bean, and North Face catalogs, because I'm an outdoorsman. I don't know about you, when I move my bowels, I like to price kayaks.
We often get calls at the Ovarian Cancer Research Fund about nutrition and diet and alternative therapies for...
And with the healthcare crisis that we have, who's going to decide who gets these stents and who doesn't?
That's the dilemma. Every tertiary care facility that has an interventional laboratory will have.
There are many problems facing us in the world of medicine. Many conversations are taking place, and the public should know what is being said. Join us for a panel discussion. First, let's take a brief look at the history of health insurance. Hospitalization came along in the late 1800s. The intentions are good, but the reality is...
Tort reform now! Tort reform now!
Perinatologist, $120,000 to $330,000. You can't practice medicine if you're paying those kinds of malpractice premiums. And it's not just the specialists. We have family practitioners whose rates have gone from $8,500 to $44,000.
We're in Trenton tomorrow, and on Wednesday we're going to Senator Vitale's office at 11 o'clock.
Now, Dr. Clemente will try to sort it out with our panelists.
At the end of the day, when there's a frivolous lawsuit, all our premiums have to go up. I mean, all these attorneys are being paid, this court time. What can you do to decrease these frivolous lawsuits? The trial attorneys tell us there's no problem.
If we continue this, quote, perfect tort system, we're going to bankrupt the healthcare system. So you may be able to get all the requests you want in court. There's a little problem. You won't be able to get any healthcare because you won't be able to afford any healthcare. There won't be any doctors to provide healthcare. There won't be any nurses to provide healthcare.
Recently, we see increases of 10 to 20, 30% a year from HMO companies. We know what that's done to our medical practice. But Jack, you were practicing during a time where there were no HMOs, and then HMOs started. What happened to the hospital with the advent of HMOs?
Currently, as of the moment, are generally statewide operating at a 0.9%, which is less than 1%.
Profit.
And that's their area of margin in terms of reimbursement.
The Meridian Hospital System in 2001 paid $1.5 million for premiums. This year they're going to pay almost $5 million in premiums, just over a couple of years. That's the hospital. It affects the cost of health care all over.
I mean, you see assisted livings and nursing homes popping up all over. There's no nurses to staff them. People don't want to do what I do. People have no comprehension of where I put my hands and what I do to people. And a lot of people probably couldn't do that. And I understand that. But without nurses, without doctors, if people get sick, what do? People will die. Without hospitals, we're in crisis, and it doesn't seem to be getting any better. It's getting worse.
The earliest federal involvement in hospital care was mandated by the 1798 United States Marine Hospital Service Act, which provided hospital care for disabled seamen whose wages were deducted for health care. In the late 19th century, hospitals acquired a reputation as places where one might actually be cured of a certain...
But with the potential for everybody to suing for just anything, doctors have to practice defensive medicine. Thus, if there's any possible test that they might even think about, they better order it.
Let me tell you, we are going to get our patients talking. In the emergency department, every woman I run into is going to call their legislator. That's the way we have to do it. That's the way we're going to get this changed.
It may be easy to forget that healing institutions could not exist without caretakers devoted to practical daily needs of sufferers. In closing, I would like to say thank you for watching, and please write us with any comments, questions, or solutions. Contact us at feedback@medicalchoices.tv. We would love to hear from you. And remember, you have more power than you think.